Here are three sequences of MRI of the neck in 80-year-old presented with history of vague right-sided neck pain. MRI was performed. What we see on this MRI is this well-defined lobulated ovoid-shaped abnormal signal intensity area situated in the mid aspect of the right parotid gland, involving both superficial and deep lobes. It shows homogeneous increased signal intensity on Dixon water sequence, and when we suppress the water, it shows homogeneous low signal intensity on Dixon, and on T1 sequence, it shows low signal compared to the parotid gland and is iso-intense signal compared to the muscle. The margins are thin and smooth, and there is no evidence of extension beyond the parotid gland. So, based on these features are most likely to represent a primary salivary gland tumor, most likely to be benign. In view of iso-intense signal intensity to the muscle and complete suppression of the fluid on Dixon water suppressed image, features are likely to represent a cystic lesion, but with which is slightly more than water. We subsequently performed ultrasound and ultrasound guided FNA, which showed this to be a mucocele. So when we compare the findings of FNA, the MRI findings correlate very well with mucocele, and we discussed this patient further in the MDT and decided to do an ultrasound follow-up in 3 months' time to see if there is any increase in the size of this abnormality. The plan was to observe and treat it non-operatively.